See.
Now you should be live.
Okay.
There you go. Okay, you're live.
Hi, can you hear me now? I hope you can hear me now, and I hope all of you were patient with my getting started because this is the first time I've done it, and it's kind of tricky. I've done a lot of Zooms, but I haven't done a lot of Facebook Lives. This is my first one. So, my name is Audrey. I'm a senior consultant with Stem Cell of America, and I'm here to talk to you today about Parkinson's disease and how we help to control the symptoms and the progress of the disease with stem cell therapy. And you're going to have an opportunity to put your questions in, and that should all be great. So hopefully all of that's going to work out just fine. So first of all, I'm going to tell you a little bit about Parkinson's. So each year, Parkinson's disease strikes 1 out of every 200 older Americans. That is more than multiple sclerosis, muscular dystrophy, and ALS combined. I saw a lot of people that are getting Parkinson's disease. And Parkinson's disease results from a lack of the chemical called dopamine. And dopamine is produced in the motor cortex of the brain. When there is damage to the neurons or the neurons have died, that's when the dopamine production in the brain either becomes much less or stops entirely. And many of you watching this now probably take some kind of medication to give you temporary dopamine, pharmaceutical dopamine. But the problem with that is that it wears off. That's number one problem. And number two problem is that it doesn't really treat the cause, it only treats the symptoms. Now we're treating the cause of dead and dying neurons in the motor cortex of the brain, specifically in the area called the substantia nigra in the brain. And that is how we actually bring the symptoms under control for years at a time. And we also, are slowing the progress of the disease as well. So I'm going to tell you a bit more here. So, most people who get Parkinson's are 60 years of age or older, but there's something called early onset or young onset, as they're referring to it now. Um, and that, I'm getting a little notices coming up on my screen here. That young onset starts at about 40 years old, or even after that. So there are people who contact us who have that young or early onset Parkinson's also. And there seems to be a high genetic correlation between having Parkinson's and other members of your family having this disease as well. So it's about 15 to 20% of the people that we see have some kind of genetic correlation with Parkinson's, but it can also be brought on by toxins in the environment that damage the brain. So those are the two, and then there are unknown causes of Parkinson's as well. But what is Parkinson's and how does it affect you? Parkinson's is a chronic and progressive disorder, meaning that its symptoms get worse over time. This is what we are trying to slow down with the treatment. We are trying to control the symptoms by doing repair and regeneration within the motor cortex of the brain, specifically the area called the substantia nigra, which is responsible for dopamine production. Okay? And so let's talk about the symptoms of Parkinson's a little bit. So early symptoms are usually tremors, and it could be on in your hand or your arm or your foot, and it's usually on one side of the body to start out with. But as the disease progresses, it's characterized by slowness of movement, muscular rigidity, tremors, problems with speech, facial expression, shuffling gait, and balance issues. Other daily activities become increasingly difficult too. And in some cases, the patient becomes incapacitated. There are other symptoms that also show up with Parkinson's, and let me tell you about some of those symptoms. Um, so, we're going to talk about rigid muscles, impaired posture and balance, loss of automatic movements, speech changes, writing changes. People will always tell me they have very cramped, very small handwriting once they've developed these symptoms. And other kinds of complications can be cognitive difficulties, emotional changes, anxiety is widely reported, chewing and eating problems, and sleep disorders, bladder problems, and constipation are commonly reported. Some other changes are blood pressure changes, smell dysfunction, fatigue, pain, and sexual dysfunction. So I think I've covered a lot of territory here, but the important thing to know is that Parkinson's is a progressive disorder, which means that over time, if you don't find a way to control it, and medication does not control it, you are going to have worse and worse symptoms of Parkinson's over time. So let's go back and talk more about stem cell therapy for Parkinson's, since I got through that first part. So let me tell you about that. So first of all, Stem Cell of America has been in existence now for 29 years. That makes us the pioneer not only in the type of stem cell therapy that we do, but in any kind of stem cell therapy. We are pioneers in this field. Now, we use pure, pristine neuronal stem cells to treat Parkinson's. We also use another kind of pure, pristine cell called the hematopoietic stem cell. And if you fill out a contact us form and you talk to me, I can go into, or one of our other consultants, I can talk to you about this in much greater detail. But I'm just trying to cover the basics here so you get a picture and you don't get too bored listening to me. Anyhow, so let's talk about what the stem cells can do. So basically, you're going to receive those neuronal stem cells by injection. And those stem cells, they're usually injected in the fat layer of the abdomen, right under the skin. It's called a subcutaneous injection. And those stem cells are picked up by the lymphatic system and then cross the blood-brain barrier. That's how they enter your brain. Now, only cells that have the right cellular linkages can actually cross the blood-brain barrier. So that's a very important thing to know. And neuronal stem cells do have these cellular linkages. Now, the cells that we use are also what they call pluripotent, which means they can become different kinds of cells within their category. So neuronal stem cells can become any kinds of cells in your brain and in your nervous system. And there are different kinds of cells in your brain and your nervous system. These cells are going to end up in your motor cortex of the brain, more specifically in the substantia nigra, and they're going to replace the cells that are there so that you begin to have a halting and reversal of symptoms, and that can be for years at a time, depending upon how progressed your disease is and other factors in your health. that do contribute to that. So that's a good thing to discuss with your consultant. And when we are halting and reversing symptoms, we are also slowing the progress of the disease. Now, again, medicine is a temporary relief of symptoms. It's synthetic dopamine that is flooding your body and taking away your symptoms, maybe for 4 or 5 hours at a time, and then you have to take another dose. That is not what we're doing. We are actually treating the problem, which is in the brain. So that's a big, big difference. So we use these neuronal stem cells, I told you about them, and these cells replicate at a very high rate. The kind of cells that we use are able to replicate 40 to 60 times exponentially over the first 3 to 6 months after treatment. Now, why is that important? Because we're giving you tens of millions of cells, which sounds like, wow, tens of millions of cells. But that's not enough cells to really treat the brain. You know, cells are infinitesimally small, and they have to replicate when they get into your body. And when we're talking about replicating 40 to 60 times exponentially, what we are talking about is 10 million with 40 zeros after it, a huge number of cells. And that takes about 3 to 6 months. Now, we use another kind of cell which works on the body, but it does something very special that I want to tell you about. That cell is called the hematopoietic stem cell. You like that word? I bet you can't spell it. It's a spelling bee word for sure. But the hematopoietic stem cell has several different qualities, and we administer these cells via IV into a vein in the arm. The saline solution is started first, and then the cells are front-loaded into the line and pushed in by the saline solution into your vein and circulate through your body. What is one of the first things that these cells do is they boost your immune system. Your body recognizes the cells, and it boosts your immune system. So when people get treated, they have this response. They have a feeling of well-being. Some of their symptoms diminish right away, but that's a short-term effect. Now, the longer-term effect is going to be those neuronal stem cells replicating and doing repair and regeneration within your body. So you have to know that there are two different kinds of responses that you're going to get when you're treated with the stem cells that we use. So to go on from there, we do these, these treatments, and I can go into all the details and all the questions that you have if you simply fill out the contact us form. I think it's pinned in the comments. And yes, Craig Key, it is hematopoietic. You got it. You spelled it right. You're very clever. And but it is pinned there, the contact us link. And that's the link to use to fill out a form so that one of our consultants, and they're all just as educated as I am, can respond to you and answer your questions about your condition and how these stem cells will help you. So to go on from there, basically this treatment takes about 90 minutes. We bring you to our clinic. We bring you back from the clinic afterwards. You will be staying in San Diego during the treatment, and we take you to our clinic, which is just on the other side of the border in Mexico. And that is largely because the FDA has not approved any kind of treatment that involves stem cells from a donor. And the stem cells, there are two types of stem cells. There's called autologous, which are from your own body. Now, you can't take brain cells out of your brain and give them back to yourself. That just will not work. It's not safe, not a good idea. You have to use stem cells that are going to be able to replicate, etc. So what The other kind of stem cells are called allogenic. And the FDA has not approved any allogenic stem cell treatment in the US at all. All you can do is they take the fat out of your body here in the US, they spin it out, they get something called mesenchymal stem cells, which are very nice, but they can only become bone or fat. I don't think we need more bone or fat to treat Parkinson's. Not really. We need neuronal stem cells. So that's what we do, is we use the cells that are going to be able to treat this condition and treat it safely. We have over 80% success rate in the treatments that we offer. We treated about 10,000 patients, and right now Parkinson's is the #1 condition that we treat. So that's very important. I'm going to take a peek and see if anybody else has any questions that they've submitted. No, not yet. But anyhow, I do see that there are people out there. There are viewers out there, and you're welcome to submit your questions, and I would be happy to answer some of them. And I do encourage you to submit click on that contact us link and submit your information, and then one of our consultants will be in touch with you and really go into great detail and answer all of your questions about the treatment that we offer. Let me tell you some more details. It's very interesting. Recently, I spoke to a patient who had been treated, and he was telling me his story. And, he went to his neurologist prior to having stem cell therapy. And the neurologist does an inventory, which is a scoring system for saying how you may be impaired. And so he did this, and he had a number of about 18 initially. Then he went back 6 months later. That's 6 months after he had the treatment. And his neurologist tested him again. And this time on the inventory, his score was an 11. Now, I have to tell you, the neurologist was shocked because nobody's score improves. They only expect for the scores to get worse over time. So that's just a little indication of the kinds of things that change. And of course, this gentleman told me he no longer has the symptoms. Now, the thing is, it is a progressive condition. The symptoms may arise again after several years. And at that point, you might want to come back and have an additional treatment. But look, in 3 to 5 years, there can be a lot of developments in this field of treating Parkinson's. So we don't know what's around the corner. But right now, what's important for you is to halt and reverse the symptoms so that they don't keep getting worse and your disease does not progress as quickly. That is the essential right here. And we have treated a lot of people. If you go to our website, you can see a lot of videos. If you send in the contact us information, then you will also be able to speak to us, and we'll go into even more detail with you. We can talk about everything that you could possibly want to know about the treatment, how it's set up, what it costs, when it's scheduled, all of that. I can tell you that our next treatment is April the 20th. We are about 2/3 full right now for that treatment. So there are some spaces left for that treatment in April. If you are interested in this treatment, go to the Contact Us button, fill out your application, send it in, and somebody will be in touch with you within a day or two. They'll send you an email. Oftentimes, consultants will send you an email first with a lot more details and then follow up with a phone call. But we will be in touch with you. You can be guaranteed of that. So let's talk about more people that we've treated. Of course, many people know about Ed Begley Jr., who we treated. Ed Begley Jr. came to us in 2016, and has very kindly allowed us to use his name. He had tremors and he had a very weak voice. Now, neither of those things are very good for an actor. And I can tell you that he came to us, he's been treated, and he doesn't have those symptoms anymore, and he has a very robust acting career. Apparently, there are more questions. Oh, here we go. Somebody wants to know if there's any downtime. That's a very good question. Thank you very much for that question. And there is no downtime after treatment. Generally speaking, the people who come for treatment with us can return home that evening if they want to. Many people will stay an extra night in San Diego and go home the next morning, but that's just strictly for their convenience. There is no downtime. And there's another question here about how long is it going to be until you see the changes. Now, as I talked about earlier, there's two different kinds of responses to the cells. One is the short-term response, which has to do with the waking up of your immune system. And then you start to feel better, your symptoms start to lessen. But that is not what we're looking for really longer term. It's going to take 3 to 6 months for the cells to replicate 40 to 60 times exponentially, which I told you is like if we're giving you tens of millions of cells, that's going to be tens of millions of cells with 40 zeros after it. That's a lot of cells. So that takes time. However, people do see changes all the way along. But you can expect the optimal changes from the treatment in that 3 to 6 month time period. And our staff, our follow-up department does follow up with you. So, and they're available to talk to you. So you have somebody to turn to and ask questions of after your treatment as well. Let me see if there are any more questions that I can answer. Well, there are more questions. We do have a database, but the database is not open to the public. You know, in the United States, they have something called HIPAA regulations. HIPAA means it's a privacy act for people, health practitioners. We cannot share people's personal details with anybody else without their permission. So we can't share our database with you, even though you asked that question. But I can tell you, some things. If you need me to look something up, I can look it up. I can tell you, and I'm sure the other consultants can do the same. But we don't share private information publicly. That's not kosher. Let's put it that way. Let's see, are there any other questions that anybody has? And I'm so excited that you're here. Actually, we're going a little bit beyond time. All right, I think we've covered a lot of the questions that are here. And I think let me see, there's some little notifications coming in. Okay, all right. If you have more questions, I'm available. The other consultants are available to talk to you. And we'd be more than happy to do that. And we'd be really happy to respond to anything that you ask us. So I hope that you take this time to listen to this video to understand what it is that we do. And if you are interested in knowing more, there's no obligation, of course. Fill out the Contact Us form, which is linked right in the comments section below my image here. So I want to thank you very much for tuning in to my first foray into Facebook Live. And I hope that you got something good out of this. Thank you very much. Bye.